Before we begin, a few important words. This recording is intended for relaxation, personal development, and general well-being. It is not therapy, it is not medical treatment, and it is not a substitute for professional care from a licensed healthcare provider. No specific results are promised or guaranteed. Every person's experience is unique, and what you take from this session is entirely your own. If you are dealing with a medical condition, a mental health concern, or are currently receiving treatment of any kind, please continue to work with your healthcare provider. This recording is meant to complement your well-being, never to replace professional guidance. Hypnosis recordings, while effective for many people, are not a replacement for working one-on-one with a trained and highly skilled clinical hypnotherapist. If you are dealing with a specific issue and would like personalized help, I invite you to visit phobiafree.life and schedule a free consultation with a certified clinical hypnotherapist. Before we begin, this recording contains hypnosis. Please do not listen to this while driving, operating machinery, or doing anything that requires your full attention. Find a quiet, comfortable place where you can simply relax, undisturbed, for the duration of this session. If at any time you need to be fully alert, you can simply open your eyes, take a deep breath, and return to full waking awareness immediately. Find yourself in a comfortable position now. And you don't need to do anything in particular, just allow your body to settle the way it naturally wants to when given permission to simply be still. You might notice the weight of your body against whatever is supporting you right now. And isn't it interesting how you never really noticed that support before, and yet it was always there? Your eyes can remain open, or they may find their own way to close, and some people find their eyes closing almost before they expect them to, and that's perfectly fine, because your unconscious mind always knows exactly what it needs. With each breath you take, you don't even have to try to relax, because relaxation isn't something you do, it's something you allow, and your body already knows how. Perhaps you notice a gentle heaviness beginning in your shoulders, or maybe it starts somewhere else entirely. It doesn't matter where it begins, only that it spreads slowly, naturally, the way warmth spreads through your hands on a cold day, without any effort at all. And as that comfortable feeling continues to deepen, your mind may begin to drift a little, the way it does in those moments just before sleep, when thoughts become softer, less urgent, more like clouds passing than anything requiring your attention. You don't need to follow every word I say. In fact, your unconscious mind is already doing exactly what it needs to do, and your conscious mind is welcome to rest. With every breath out, just a little more comfortable, a little more settled, a little more yours. And when you're ready, we can go somewhere quite wonderful together. I want to start by saying something that might sound counterintuitive. Your health anxiety, that constant monitoring of your body, that interpreting every sensation as a symptom, that Googling that always leads to the worst case scenario, it comes from a good place. It comes from caring about your health, from wanting to be okay, from wanting to live. There is nothing wrong with wanting to be healthy. The problem is that your caring has become so loud, so constant, so intense, that it's doing the opposite of what it intends. It's making you feel worse, not better. Because here's the thing about paying too much attention to your body, you start noticing things that were always there. That heartbeat you can suddenly feel, it was always beating. That tightness in your chest, that's the muscle tension from worrying about your chest. That strange sensation in your stomach, that's anxiety, not disease, anxiety. Your body produces hundreds of sensations every single day. Twinges, aches, gurgles, pulsations, flutters. Every healthy body does this. But most people don't notice them because they're not looking for them. You notice them because you are. And once you notice them, your anxiety interprets them as evidence of something terrible. And then the anxiety creates more symptoms because anxiety is physical, which gives you more to be afraid of. And the loop continues. Tonight, we're going to break that loop, not by convincing you that you're healthy. That's your doctor's job, and you should continue to see them, but by changing your relationship with your body from one of suspicion to one of trust. First, a feeling. Think of a time when you trusted your body completely, when you weren't monitoring it, when you weren't interpreting every sensation, when your body was just your body, something you lived in without constantly checking on. Maybe it was before the health anxiety started, a time when you could feel a twinge and think nothing of it, when a headache was just a headache, not a catastrophe, when you could go through an entire day without once wondering what that feeling in your chest meant. Or maybe it was during something physical, a sport, a hike, a swim, when you were using your body so fully that there was no room for monitoring, just movement, just being alive. Or your own moment, a time when your body was an ally, not a source of fear. Find that feeling, the feeling of trusting your body, of living in it without fear, whatever your word is for that feeling, and let it come back. And notice what happens when you find it. The monitoring pauses, just for a moment, that constant internal scanning. Am I okay? What's that feeling? Is my heart doing something weird? It quiets. And in the quiet, your body does something remarkable. It relaxes, and when it relaxes, the symptoms that anxiety was creating, the chest tightness, the stomach churning, the throat constricting, they begin to fade because they were never disease, they were tension, and tension dissolves when the monitoring stops. Let that trust spread now. Through your chest, through your belly, through all the places you've been watching so anxiously, and instead of watching them with suspicion, watch them with gratitude. These organs, these systems, they've been keeping you alive every second of every day without you ever having to ask. Your heart has beaten, how many times, without missing a beat? Your lungs have taken, how many breaths, without needing your supervision? Your immune system has fought off, how many infections, without you ever even knowing? Your body is spectacularly good at its job. It has been keeping you alive for your entire life, and it doesn't need you to supervise it. It needs you to trust it. Good. Now amplify that trust. Double it. Feel it becoming a warm, solid, steady confidence in the machine you live in. Not blind confidence. You'll still see your doctor. You'll still take care of yourself. But a grounded confidence that says, my body knows what it's doing. It's been doing it for decades. and a twinge is just a twinge. Double it again. You know, Erickson worked with a patient once who was convinced something was terribly wrong with her. She'd been to every doctor. Every test was normal, but she couldn't stop believing she was sick. And Erickson didn't argue with her. He didn't try to convince her she was fine. Instead, he asked her a question. He said, "Has your body ever healed a cut?" She said, "Yes." He said, "Did you tell it how to do that?" She said, "No." He said, "Then perhaps your body knows a few things that your worrying mind doesn't." And that's the truth at the center of this. Your body has an intelligence that operates completely independently of your conscious mind. It heals wounds without instructions. It fights infections without strategy meetings. It regulates temperature, blood pressure, digestion, hormone levels, thousands of processes, all running perfectly all the time, without your input. And the idea that you need to constantly monitor it, as if it might forget to work, is like standing next to a river and worrying that it might forget to flow. And you might try, right now, to scan your body for something wrong. Go ahead, do that old familiar check. What's my heart doing? What's my stomach doing? Is that sensation normal? And notice something different this time. Instead of finding fear, you find trust. Instead of interpreting the sensation as danger, you notice it, and it's just a sensation. Not good, not bad, not a symptom, just your body doing what bodies do. And for once, that's enough. You don't need to Google it. You don't need to check it again in 5 minutes. It's just a body, working, living, being alive. And that's actually quite wonderful. Now, imagine a day in the future. You're going about your life, and you feel something, a twinge, a flutter, an ache. And instead of the familiar spike of fear, instead of the spiral that starts with that could be and ends with "I'm dying," you notice the sensation and you think, a twinge. And then you go back to whatever you were doing. Not because you're ignoring your body, but because you trust it, the way you trust your heart to beat without checking, the way you trust your lungs to breathe without counting. You've handed the job back to the system that was always running it, and you've given yourself permission to stop supervising and start living. And each day that you live this way, each twinge that comes and goes without a spiral, the trust deepens, the monitoring fades, and you realize that the time you used to spend checking and worrying and Googling is now available for something else, for being, for enjoying, for living the life that your body, your magnificent, intelligent, trustworthy body, is working so hard to give you. And now, in a moment, I'm going to count from 1 to 5. And you can choose. Open your eyes, feeling a deep trust in your body, carrying that trust into your day, or drift into sleep, your body doing exactly what it knows how to do, without your supervision, perfectly, completely, all night long. Whatever you choose is exactly right. 1. Awareness shifting. The trust stays, the monitoring stays off. 2. Your body is working beautifully. It always has been. 3. Coming up or going deeper, your body knows what it needs. 4. Almost there. trusting, calm, free. 5. Eyes opening, grounded in trust, or eyes staying closed. Your body taking care of everything while you rest. Whichever you chose, your body knows what it's doing. It always has, and you can trust it.